What's up, Everything Medicare Podcast Nation? Welcome to episode 102 of the Everything Medicare Podcast. I'm your host, Christian Brindle, where every single week I bring you 3 episodes, me and my company do anyway, where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. Thank you so much for listening. Thank you so much for everybody that's been listening week after week after week after week as we put out more and more, in my opinion, incredibly quality content, some of the most quality Medicare content that you will find anywhere on the web, where you can pretty much listen to the information and apply it to your situation no matter where you happen to be in the country. So, today, folks, I'm going to unveil something that, in my opinion, is a very interesting topic. So, I've done a lot of episodes about Medicare supplements on one side, and I've done a lot of episodes about Medicare Advantage plans on the other side of the coin. And every single guest I've had on this podcast, I believe every single guest that's come on and talk about Medicare, I've had a couple of people come on that are life insurance experts and burial insurance, final expense, and that kind of stuff. And so I didn't ask those individuals. But anybody that's come on this podcast to talk about Medicare, as far as my memory serves me, I believe I've asked one question in common of all of them because I'm interested in their perspective. And that is, what side of the coin do you lean towards? Medicare Advantage plans or Medicare supplement plans? And I always like to preface the comments by saying, obviously, one side of the coin is not going to be the best fit for every single person. I always try to disclose that before I ask the questions in the past when I have guests on to be interviewed by me for your consumption. And typically, folks, the people that I have on are people that are accomplished in the industry, people that are very knowledgeable in the industry in their particular field. Most of the people that come on talk about Medicare because this is the Everything Medicare podcast. But Medicare is not a one-size-fits-all. I've had some people tell me, if I hear you say that again, I'm going to go insane. I'm going to start losing my hair like you are, because I'm starting to lose my hair a little bit. But it's true, and I probably will say it 101 more times going forward in the future, but it is true. Medicare is not a one-size-fits-all, and Medicare supplements have their positives and negatives that go with them, and Medicare Advantage plans have their positives and negatives that go with them. But I've always asked my guests, obviously, taking that into consideration, but if you had to lean towards one side or the other, which one would you pick? And I realized that I never did an episode where I kind of talked about my feelings on that myself. And so it felt a little hypocritical to me because I've done a lot of episodes where I talk about the good, the bad, the ugly of Medicare Advantage, and I've done the good, the bad, the ugly of Medicare supplements, but I've never really put myself in that hot seat to answer that question because it's a difficult question to answer. And if if my guests come on here and answer it, then why not me too? So I wanted to disclose that first things first because I'm not saying that anybody's listening, every single person that's listening that has a Medicare Advantage should switch over to a Medicare supplement if I was going to go that way, and I'm not going to suggest that every person that's listening to a Medicare supplement should switch over to a Medicare Advantage. I'm not saying that at all. It's specifically based on your needs and preferences, but the way I would look at it is what I would pick for me. That's the way I would answer this question. If I was turning 65 tomorrow, or if I was needing to sign up for something tomorrow for Medicare, I'm not eligible for Medicare. I wish that I was. But if I was eligible, what would I go with, personally? And this is kind of what I would do, for me personally, folks. And this is not going to be the most politically correct or probably popular answer. But I am going to answer you, one or the other. Before I do that, though, I want to tell a story about the pitfalls of both sides of the coin before we go forward. I will tell you in segment 2 what my answer is. But let's start about the pitfalls of a Medicare supplement. Okay. Here's the pitfalls of a Medicare supplement. Okay. Let's say someone contacts me and her name is Mary. Okay. Mary. There's a lot of Marys in my stories, although this is just a generic story that I've probably ran into a million times over the years in my career. But let's say someone contacts me and her name is Mary. Mary's turning 65. My approach with my work with people that are turning 65 is I always like to go through both sides of the coin. I like to explain the Medicare supplements and also the Medicare Advantage plans side by side, explain the good, the bad, the ugly, and let them decide what they think is better for them. I typically, unless they just are really on the fence, then I'll kind of dissect it a little bit and be like, okay, well, excuse me. Well, your needs are X, Y, and Z. Maybe this plan would make a little more sense for you. But I usually just kind of let them go where they want to go. Because in my opinion, as long as I do a good job presenting the information and explaining it in a way where there's nothing hidden, and they're knowing the pitfalls of both sides, then if they already know the pitfalls and they still want to go with that anyway, that's better indication to me of what's best for them, because they know their situation better than I ever could. They know their health history better than I ever could. We run comparisons, prescription drug comparisons, check their doctors if there's a network involved, that kind of stuff. But let's say I sit down with Mary, I go through this process, and Mary says, I want a Medicare supplement. I say, okay. But let's say, hypothetically speaking, that Mary is incredibly healthy. Mary goes to the doctor once a year, get a physical. That's it. Mary's really healthy, but Mary picks the Medicare supplement because she's in a situation where, she would rather get the supplement at guaranteed, because remember, when you turn 65, you have a new to Medicare window, or maybe not necessarily when you turn 65, but the first time you get on Medicare, you're in your open to Medicare window, you're new to Medicare window, and from that point, you can get any type of plan with any type of insurance company you want without any health questions or underwriting, But with Medicare supplements, if you're outside of that window, there's a lot more health questions and underwriting than the Advantage plan. So let's say she takes the supplement plan because she wants a guarantee that she'll be able to get it and have it. Okay. She does this, but she doesn't really have the need. So the pitfall for Mary is simple. She's going to be paying a lot more monthly premium than she would for Medicare Advantage plan, because with a Medicare supplement, you have your Medicare Part B premium. Right now it's $135.50 unless you're in a high tax bracket, in which case you pay more. But you have that premium. You have your Medicare supplement premium, whatever it is, depending on the state. That really has more to do with the state than anything else, as far as the ballpark figure. And she pays a separate premium for a Medicare Part D drug plan. Let's say she doesn't take any drugs, but my recommendation even in that situation is she pick up a drug plan, because if she doesn't pick one, she gets penalized, which I've done episodes about that in the past. And it's just in her best interest to take the drug plan to avoid the penalty, because if you don't take a drug plan, the penalty sticks with you whenever you do take the drug plan down the road for the rest of your life. And usually most people are going to need a drug plan at some point. It's a terrible program, but that's what the government does. She doesn't take any drugs, Mary. She sees her doctor once a year for a physical, Mary. So in Mary's situation, my first reaction, and I probably would say this if I had this situation become before me, I'd be like, just so you know, Mary, you're paying a lot higher monthly premium than you need for what you need at this point. Now, can your health change? Yes. Can your health change? Yes. But assuming that it stays relatively what it has been, I mean, there's two sides to this. There's two sides. There's two perspectives. But I'd want her to think about, assuming your health doesn't change, or maybe it changes a little bit, but right now you're taking no medications, you're really healthy, you just take it a physical once a year, you're paying a lot higher monthly premium than you need. A Medicare Advantage plan would basically suit those needs. You'd be able to get your physical one time a year and it'd be free, whereas Medicare with a supplement doesn't pay for a physical after your first 12 months. They'll pay for a wellness visit, but not an actual physical. So that could be something she runs into unless she's okay with the wellness visit. A wellness visit is, in my opinion, a less detailed physical. But Mary'd be paying a lot more premium because she'd be paying 3 premiums. Medicare Part B, supplement, and drug plan, and typically the supplement premium is going to be much higher than that of a Medicare Advantage. Now, there's some markets where that's not the case, so this doesn't apply to everywhere, but in most places, yes. So, I would say that to Mary. These are the obstacles you're going to face. Higher monthly premium than probably what you need. You don't take any drugs, so you have to pay an extra premium for the drug plan. Whereas with a Medicare Advantage plan, it'd be much simpler to get a plan that doesn't charge any extra for the drug plan. It comes with the plan included. Not all Advantage plans come with drug coverage, but it's not hard to find one that does. And the physical, the one thing you do get right now after your first year, isn't covered by Medicare. So the only benefit for Mary to take a Medicare supplement in her situation is quite simple. That's if her health goes down the toilet. Can that happen? Sure. But at this very moment, it's not the best fit for her needs. The only reason why she would need the Medicare supplement is quite simple. It would be if her health goes down the toilet. It's basically a safety blanket no matter what happens to her. And I get that. I understand the need for that. But that's the first thing. So there's the downside of a Medicare supplement primarily. Also, Mary probably wants dental coverage. She has to pick that up separately, a separate premium with a Medicare supplement, whereas with a Medicare Advantage plan, in a lot of markets you can get some dental coverage included now. In some markets it's not much, so it doesn't really matter anyway. But in other markets you can get a ton of dental coverage with your Medicare Advantage plan. It really just depends on where you live. So that's why this is not an easy question to answer. But that's the pitfalls of a Medicare supplement, in my opinion. Overpaying for a plan that you really don't need as far as your specific needs. Paying separate for your drug plan and your dental, vision, hearing. Okay? So let's talk about the pitfalls real quickly of a Medicare Advantage plan. Okay, let's say another person, we'll call her Andrea. Andrea comes in, talks to me, turns 65, I go through the options, she leans towards the Medicare Advantage. But let's say Andrea is... she picks the Medicare Advantage plan because she wants a $0 premium plan. Let's say it's available in her market. $0 premium plan. And she is on a budget. She lives off Social Security. She wants a $0 premium plan. She wants the drug coverage included. All fine and dandy. Wants the dental, vision, hearing, that kind of stuff. But let's say she's not healthy. Let's say she uses her plan quite a bit. Well, with a Medicare Advantage plan, as you may know, if you've listened to me for some time, Medicare Advantage plans, Medicare supplements, you're going to have full coverage, if not close to full coverage, on the medical bills. Medicare Advantage plan's the opposite. You have copays pretty much for everything. It's an as-you-go basis as far as how much you pay. The copays, if you use it enough, can very quickly add up to much more than you'd pay in premium for the supplement. So that's why this is such a tricky thing, such a tricky question to answer. But Andrea obviously is doing herself a disservice to pick up a Medicare Advantage plan because let's say she sees a specialist once a week. Well, in a lot of areas, specialist visits are $30 a pop, $40 a pop, $50 a pop. Just depends on where you live and stuff like that. And, it could be as low as $20, but let's say it's $30, $40 a pop. Every week, you're then making up the difference in premium by itself in specialist visits. And there's a lot of people out there that do that. Not everybody, but there's a lot of people that do that. So Andrea is doing herself a disservice. She'd be better off with a Medicare supplement. And at that point, I would make sure she understands this, my perspective on it. But at the end of the day, I'm going to do what somebody wants me to do as a broker. I'm going to make sure they understand this. But if they say, hey, I get this, I understand this, I want this anyway, and if you're not going to do it for me, I'm going to go find someone else that will, yes, I'm going to do it. But I'm going to make sure they understand where I'm coming from first. So for Andrea, Medicare Advantage plan probably isn't the best fit. She'd be better off just paying the premium and not having to worry about copays, in my personal opinion. Let's say, that type of situation. Because typically if your health, and this isn't always the case, so I'm not a doctor, I don't pretend to be one, but if your health typically isn't great at 65, it's probably not going to get much better after. There's exceptions to this. I've seen people turn their health around dramatically through, different exercises and, changing their diets and stuff like that. But a lot of times, usually probably your health needs are going to increase as you get older for a lot of people. So if someone needs a supplement at probably 65, they're probably going to need it even more at 66, 67, 68. Stay with me into segment 2. I just kind of went over the usually a more often than not pitfall of both sides of the coin. Segment 2, I'll unveil what I think after a quick word from my man Randy Hall, the Mr. Nice Guy Medicare advisor. Listen to what he has to say. You're going to want to hear it, especially if you live in Tennessee and Kentucky. When we come back in segment 2, I'll answer the question. Don't go anywhere.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare Advisor, not Christian Brindle, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
Welcome back, everybody! If you live in Tennessee or Kentucky, I hope you enjoyed that message from Randy Hall, the Mr. Nice Guy Medicare Advisor. I encourage you to give him a call. He's got integrity. He's got experience. He's got multiple companies. He's a Medicare expert. He's got everything you need in those two states. I encourage you to give him a call during this enrollment period if you need help with your Medicare. All right, let's jump in to segment 2 of this week's Everything Medicare Podcast, where I answer probably the most difficult question there is to answer in the Medicare industry as far as my personal perspective. Okay, so I kind of broke it down, the pitfalls of both sides. Medicare supplements, if you're healthy, you're going to overpay for premiums, typically for years, and that could maybe make up the differences what you pay on a Medicare Advantage plan. If you're healthy, paying for the drug coverage, you don't get the physical covered if that's all you get, the preventative care after your first year. You get the wellness visit, but like I said, a wellness visit is, in my opinion, a less detailed physical. You don't get the dental, vision, hearing included, although that kind of depends on the market. I can't stress this enough. This really depends on where you live and what's available and that kind of stuff. So please take what I have to say about this with a grain of salt. Please just don't take it and run with it. But in my personal opinion, folks, I would say that you are probably better off. Well, I don't even want to say that. I refuse to say that, actually. I would lean more towards, though, the Medicare supplement side of things, and we've had probably 9 out of 10 of our guests say that. That's answered this question. And the reason for that is because no matter what happens to you, healthy or not, if you develop something you just never see coming, I've seen a lot of healthy people just wake up one day and they start feeling terrible, and then they go into the doctor and they have cancer or something, 1 out of 4 people will get cancer in their lifetime. I've seen so many statistics that say this. So that's a huge expense. Chemotherapy, radiation. Someone gets kidney dialysis. You're gonna hit that really quickly as far as out of pockets. Medicare Advantage plans, for this reason alone, they have set copays for everything, and I kind of broke down in segment 1 how that works. Specialist copay, hospital copay, emergency room copay, but typically they're set copays. Most Medicare Advantage plans, at least everyone I've ever worked with, everyone I've ever seen in every market I've ever been in, most Medicare Advantage plans pay 80% of chemotherapy, radiation, Part B drugs, which is high expensive injectables. And they leave 20% behind for you to pay. That adds up really quickly if you have anything serious like cancer happen to you where you need chemo or radiation. Or if you have end-stage renal disease where you need dialysis, that stuff adds up so quickly. Now, Medicare Advantage plans do have maximum out-of-pockets. And depending on where you live, it could be $2,000, it could be $3,000, it could be $4,000, it could be $5,000, it could be $6,000. It just depends on where you live and the market and the specific plan. But you'd hit that on chemo or radiation in a matter of a couple of months, if not sooner. So no matter what happens to you, you know what you have with a Medicare supplement plan. You do not have to worry about the plan changing. Now, Medicare supplement plans raise the premiums every year as you get older, so there's that. But I would lean towards the Medicare supplement plans because you know what you have. no matter what happens to your health, you're going to have full medical coverage, if not very close to it, depending on the type of Medicare supplement you purchase. And you can never lose it. There's no network. You don't have to worry about networks. Medicare Advantage plans with a lot of very important things have pre-authorization things that you need to get approved that can sometimes be a hassle. Some Medicare Advantage plans require referrals to see specialists, not all. I did an episode where I just blew up on that a little while back, so go back and listen to that if you want to hear my opinion on that. But it really just depends on where you live. But if it was me, I'd probably get a Medicare supplement just because I love simplicity. I love better coverage, and, all things considered, it's not that much money. But in some areas, it could be. I just did an interview last week with Tracy McManaman, the host of the Your Medicare Benefits podcast, and he was telling me about how in some markets that he's familiar with and works in, some supplements can be $300 a month for someone turning 65. In that case, unless the Advantage plans are just horrid, I'd probably lean towards that way. But in my market where I live, I'd probably lean towards the Medicare supplement market. If I was living in Florida, maybe I wouldn't. Because the Florida market, the Medicare supplements are very expensive in a lot of areas. More expensive than where I live in Utah. But the Medicare Advantage plans are much richer than where I live in Utah. Just a lot of it depends on the market. But if you backed me into a corner, I'd probably say I like Medicare supplements more for the reason that no matter what happens to you, your medical bill is going to be taken care of. You have great coverage. With an Advantage plan, there's so many working parts and so many variables that can make them more of a pain. Like if your doctor drops out of the network, that's a pain. Medicare Advantage plans change their benefits wildly, typically from year to year. You don't have to worry about that with a Medicare supplement. So, but like I said, there's a lot of people, especially in market. It has more, like I said, it has a lot more to do with your situation and your market than anything else. But there's a lot of people that are on Medicare Advantage plans. Medicare Advantage is clearly the best option for them. Clearly. But if I had to say one or the other, I'd say Medicare supplement for the reasons I laid out. Don't go anywhere. After a quick word from this week's sponsor, I will wrap up my final thoughts on this topic. Stay with me. Welcome back, everybody. Thank you for sticking with me all the way to the end here. I hope you didn't just tune me out when I was talking about needs, preferences, situation, everything. Because I don't want you to just hear me and just hear, my little tiny bit where I said if I had to go pick one or the other, gun to my head, I'd probably pick Medicare supplement because it's not going to be the best option for everybody. Like if you're in a market where you're paying $250 a month at age 65 for Medicare supplement, but the Medicare Advantage plan is just incredible, low out of pocket, low copays, all kinds of great benefits, full dental included, all that stuff, and you're relatively healthy on top of it, no, I would not recommend a Medicare supplement for you in that situation. It really just depends on your situation. But if I had a gun to my head and I had to lean one way or the other, I'd probably lean Medicare supplement just because no matter what happens, you know what you got as far as coverage is concerned. The coverage will never change. You have no network. As long as the doctor or hospital accepts Medicare, A and B first, the supplement will also pay afterward. And nowadays, about 98% of doctors nationwide accept Medicare. There's still a few doctors here and there that don't, but it's more of a needle in the haystack more than anything else. So because of that, I would say, personally, that I'd lean more towards Medicare supplement. But by no means am I just saying that's where everybody should go. It really depends on your needs and preferences. I'm so sick of saying that, but it is fact. It is gospel, and please take that into consideration when you're hearing me on this, okay? Folks, we are just a few days away from October 1st where we can unveil changes for Medicare Advantage plans and Medicare Part D drug plans for 2020. We can talk about it. And starting October 15th, going through December 7th, you'll be able to change your plan if you're not happy with it, or if you just want to compare it, see if there's anything better. If you live in the states of Utah, Idaho, Oregon, or Florida, those are the 4 states. Again, Utah, Idaho, Oregon, Florida. Those are the states that my organization, Christian Brindle Insurance Services, is licensed to do business with people in. We're appointed and authorized to offer all of the major insurance companies in all of those markets specifically. If you're on Medicare and you just like to compare what you have, or maybe you're not on Medicare yet and you're just aging in and you're just lost and confused, regardless of your situation, I'd love the opportunity to be able to talk with you. So give our office a call at 801-255-5340. Again, that number is 801-255-5340 for Christian Brindle Insurance Services, Medicare specialized agency that I own and operate. If you feel more comfortable, though, folks, shooting me an email, you're more than welcome to do that as well. Christian B, Christian, B as in boy, at xmission.com. Christian B, Christian, B as in boy, at X, the letter X like X-ray, and then the word mission, MISSION.com. Christian B at xmission.com. I have a 24-hour response guarantee to emails. If you'd feel more comfortable talking with me through email and just tell me a little bit about your situation, I'd love the opportunity to be able to talk with you. And if I can help you, I'd be more than happy to do so. If I can't, I'll be sure to tell you, and then you can sleep better at night knowing that you're on the best possible thing that you can be on. Thank you so much for listening, folks. And as always, we're still doing our, what would I call this? Opportunity is what I'll call it. If you'd like to know roughly what an insurance agent makes as far as commission, remember, it doesn't cost you a penny to work with an insurance agent. It's the exact same price as if you went directly through the insurance company on your Medicare plans. And it's the exact same products you can get anywhere. There's no downside to you as long as you're working with a good agent that's going to take care of you. There's only upside for you. But if you'd like to know how much an agent makes, roughly, for each particular product that's available to you, I'll do an episode about it. I talked about this on Monday, to where if we get 5 5-star reviews on Apple Podcast and or Stitcher, combination of those two, 5 5-star reviews, I want 5. It doesn't have to be all in one place or 5 on each. It's just 5 total on those 2 platforms. I will do an episode where I will pull the sheet off on that. But if we don't get those 5, I said this on Monday for the first time, so a week from Monday, so this upcoming Monday, today's Saturday, so this upcoming Monday, which will be right before October 1st, we will, if we get those 5 5-star reviews, I will do that episode for you. But if we don't get that just tells me that you don't have a whole lot of interest in hearing that. So we won't do the episode if we don't get that. As always, folks, thank you so much for listening. Thank you so much for your support. And I hope you have a wonderful rest of your weekend. I will talk with you soon. Take care.